Aloha everybody, Dr. Summer Nicole here of Yoga Doctors TV. I'm going to try this live. We're without internet from all of the storms here in Kauai, but I'm going to see how this goes. So I wanted to talk to you guys about this this method that I've been learning, and it's just a total paradigm shift of core training and pelvic health. And so if you are a yoga instructor, a fitness instructor, a body worker, massage therapist, anything like that, like this information is super pertinent for you. So traditional core work, basically like everything we know about crunches, planks, leg lifts, all of those things increase pressure in the abdomen. And so what happens whenever you increase pressure in the abdomen is that it pushes the pelvic organs down. Okay, and so when the pelvic organs get pushed down, especially with repetition and over time, it weights the pelvic floor, and the pelvic floor becomes hypertonic or too tight. And so when the pelvic floor becomes hypertonic or too tight, you have a pelvic floor dysfunction. Okay, so meaning it can't fully contract and it can't fully relax. Now, your pelvic floor is part of your respiratory muscles, and so you need it fully to be able to get full benefit of your inhale and your exhale. So this method that I've been learning, and it's called hypopressive breathing, and then it's the exercises and postural cues that it's paired with is called low pressure fitness. So hypopressive just means low pressure. So it's this way that you can breathe and hold posture that actually decreases pressure in the diaphragm. Okay, how does that happen? So normally most of us have really tight diaphragms. Okay, so think of your how much tension you hold right here, right in the solar plexus. If you're really tight in the diaphragm and you have decreased rib mobility, decreased spinal mobility, a tight diaphragm can be from stress, anxiety, trauma, anything like that. The diaphragm, whenever we belly breathe, which as even physical therapy school and yoga instructors were taught, breathe in the belly, right? So when the diaphragm's tight and all we're doing is belly breathing, what that does is actually the diaphragm only goes up and down. Okay, if we're just belly breathing and the diaphragm is tight, it's not expanding out to the sides. It's actually just going up and down. So with each breath, with each inhale, it pushes the viscera, your organs, down. And again, pushing the pelvic organs down, weighting the pelvic floor. And so over time, you will develop a pelvic floor dysfunction, core dysfunction, breathing dysfunction, all of these things. And so basically this method is all about getting as much air into the diaphragm, getting the diaphragm to expand. And so I'm going to do other videos on the actual method itself, but I'm really curious, any of you guys out there that have worked with core and or pelvic floor dysfunction, women's health issues, prolapse, incontinence, back pain, anything like that, where you're just not getting better and you're doing, traditional core work that you think is strengthening your core, but maybe it's, making you leak more, or it's just not making you better. So, so this method gets the ribs to expand out laterally, so you get as much air into the diaphragm as you can, and so that the diaphragm expands laterally. The breath is in through the nose, and then the exhale is a slow exhale through the mouth without contracting the abdominals. So if you're a yoga student like me for a really long time, it's really hard as you exhale to not kind of naturally pull the belly in towards your spine. It's kind of almost what we've been taught a lot of the time. So this method helps to retrain your breathing patterns so that your diaphragm will expand laterally instead of just going down, and then getting the full length of your exhale so that you can fully get all of the air out of your lungs. And you have to really super slow it down so that you don't contract your abdominals. And what happens with that, while you're doing these postural cues, one of them is spinal elongation and kind of pushing through the elbows so you keep the ribs wide. What happens is your deep core muscles, your pelvic floor and your core stabilizers turn on synergistically, meaning at the same time, and they turn on reflexively, okay, meaning automatically. Okay, why is that important? Because your core muscles and pelvic floor muscles, your deep abdominals, are supposed to work for you reflexively or automatically, and if they're not, it's because you've been injured or something like that. James is dragging the garbage can. It's going to be really loud for a second. So anyway, so what happens is that the core muscles Anytime we're injured, they shut down. We have to naturally retrain them. But what we're doing with core work is actually traditional core work is we're training them consciously, but really how they work in our bodies is reflexively or automatically. So that's the kind of the magic of this method, is that we're training the core muscles to turn on reflexively, meaning automatically, involuntarily, and we're training them to turn on synergistically at the same time. So I just wanted to get this out there. I'm going to be like shouting this from the mountaintops because it's really the current research has debunked everything they've ever taught us in physical therapy school or anything else about core work, and so people need to be educated. I'd really love to know if this sounds interesting to you, if you're somebody that's suffering from any of those issues, and please leave any questions you have in the comments. Okay, and more to come soon. Aloha.